Hi, I'm Sarah, and I'm doing my head-to-toe assessment. This is my patient, Grace, and she's 21, female, obviously, and she is my volunteer. So my equipment that I have, let's see if I can flip this. How do I do that?
Can you double tap? You might just have to go again.
All right, anyways, my equipment is here in front of me that I'll be using today. And she, in a real setting, would come in, empty her bladder, put on a gown if I needed to do a breast exam or a pap smear. But for today's purposes, she's in this, and we're on a couch. So with the head to toe, quite literally, we're gonna start with that. I watched her walk in. She kind of thinking neurologically. I mean, her walk is stable, heel to toe. She has no gait disorder. So in a real setting, you would look for that, assess for that, for any sort of neuro deficit or musculoskeletal issue. Orientation. Tell me who you are, where you are. Where are you?
My name is Grace.
Yes.
I'm in Sarah's house.
Yes. What year is it?
2020.
Okay.
Can't forget that one.
Yes. 2020.
2020.
Year of COVID. So another thing I'm going to note is that skin being the largest organ in the body, is just something that's integrated into the exam as part of it, not something separate, of course, unless you were in a subspecialty like derm. So, getting started. Grace has been my volunteer many times, so I know a lot about her. Mm-hmm. But literally, we'll start at her head, and looking at hair. So, maybe needs a washing, but
I did wash my hair.
It's supple, and she, you can tell a lot about that. Like, you could assess for a thyroid deficiency. So she has all of her hair, no bald spots. Her head is normal cephalic. I don't see any lumps, bumps, anything that stands out as being unusual. Assessing the rest of her ears are symmetrical, her eyes are, everything is on her face is, where it's supposed to be. And she is, no drooping of the eyelids, eyes, her nose is midline, her lips are, bright color, no cyanosis. So all of those things obviously are not what you would talk about, but more what you observe and take in an exam. So looking at her face, and this kind of hits on some of the cranial nerves, I would ask her to raise your eyebrows, then wrinkle your forehead. I'm doing it with you. Smile, which you just did. Clench your teeth, stick out your tongue, puff your cheeks. All right, now I'm gonna put my hands on you. They're washed. So I'm feeling her jaw, and now I'm feeling, just go ahead and clench again. Okay, and I'm just feeling there's no atrophy. Her, there's symmetrical muscle development, and she is, what?
I thought there was a fly on
Oh, might have been. So she is, what's my train of thought?
Jaw.
Yes, jaw. And then feeling that joint too, is what I was trying to do. And then I'm gonna press on her sinuses for any tenderness. The ethmoid and then the frontal. Nope, she's well. And then going to go ahead and get my pen light out and gonna look for her pupillary reaction. And they constrict and dilate as they should. Then I will gonna do just an uncover test. So I'm just looking for nystagmus, strabismus, any sort of deviation of her eyes. So just look at me And her eyes stay fixated on my nose. Okay, then I'm going to look, I'm just going to do a quick look in her eyes, just looking for a red reflex, thankfully. And I'm using my right eye to her right eye. And that one's positive. All right, sorry. And that one is too. Sorry. And then just go ahead and look at me. I'm just gonna do the 6 cardinal gazes. Just follow my finger. All right, there you go. Like we've done this 100 times. All right, and then go there, there, there. And that's checking for all of the eye muscles, and that hits some of the cranial nerves as well. So getting that neuro in there. Then her sclera are white, nothing's bloodshot red, no drainage coming from her eyes. Moving on to her nose. I'm just going to take a little look up there. No drainage there either. Her septum is midline. Go ahead and open your mouth for me. Say ah, stick your tongue out. Her uvula is midline. Lift your tongue for me. And then I don't see any sores. She has good dentition. And I am not going to gag her. I have nothing to do that with, and she hates it. Yep. So then looking at her ears, there's no sores or bumps or anything on them. Let's see this one. She's got earrings. They all look healthy. Then I will go ahead and look in them. Just looking at her tympanic membrane, looking for a pearly gray. All right, and this is clean, no worries. And that one looks good and clear, no wax, no cerumen in there. Same thing there. No drainage coming from her ears. Okay, moving on to her neck. It's supple. I'm gonna go ahead and have you just push resistance against my hand. Just turn your head. There you go. Same thing this way. And then shrug your shoulders against my hands. Perfect. I can go ahead and just turn a little bit towards me. There we go. And I'm just feeling for lymph nodes. Down here, and you feeling any tenderness? Okay, across the front. I know, this would be easier actually in a gown, but we will do what we can do. Then I'm going to have you turn around the other way, and I'm going to feel her thyroid. Just go ahead and swallow for me. And I don't feel any sort of nodules or anything like that. You can turn around. Now, since I'm here on the neck, I'm going to go ahead and listen to her carotids. Listen for any bruise. Do that with the bell. All right, hold your breath. All right, breathe. Hold your breath. And I'm just going to listen here. So, no swishing, everything sounds good and like it's flowing well. Then we will go ahead and have you just kind of sit like there. I know, lots of moving for you. Then I'm gonna go ahead and listen to her lungs, just moving down. And I'm going to first auscultate just for normal breath sounds. Make sure I don't hear anything adventitious. So I will just tell you to take deep breaths. Deep breath for me. Again. Just moving side to side. One more time. Low again. Okay. her lung sounds were clear. I don't see any work of breathing. If I were to have an abnormal finding, I could percuss, and if I have any suspicion of consolidation or anything like that. Go ahead and turn this way a little bit for me. Nope, other way. Flip. All right, so down here about the 10th rib, I'm going to have you take a deep breath.
Am I holding it?
Just do it one more time, just even in and out. All right, so that helps me look for chest expansion and looking for that even expansion, and she does have it. Another thing I can do is, I'll just kind of talk through this, but if I wanted to, her diaphragmatic excursion, measure that, which a normal finding is 3 to 5 centimeters. She can take a deep breath in. I'll go ahead and do it, and I'll see if I can. It's just hard without. And hold it. You have to take it in and hold it.
Oh.
That's okay. So I'm going from like tympanic to resonant, and then take a breath out. Breathe a couple times normally, and then breathe out and hold it. Okay. And then I'm going to mark it. Okay. So, it's about 3 to 5 centimeters is what's normal. So that's part of the pulmonary assessment. Then I will have you go ahead and turn back straight. And then I'm going to listen for breath sounds interiorly. Just take a couple deep breaths. Okay, again. All right, lift your arm for me. Deep breath. Deep breath. Okay, so again, normal findings, no adventitious sounds, no wheezing, rills, rhonchi, crackles, anything like that. So while I'm here, I'm going to, I'm inspecting her chest. I don't see any heaves, lifts, thrills, anything that looks abnormal. So I'm going to go ahead and listen to her heart sounds. Going over each area, each valve. I'm going to tuck under here. No murmurs. If I were to hear one, I could flip it to the bell side and listen over those same areas and identify which valve. Also, could palpate for the apical impulse. If these days a chest X-ray very easily identifies the size of the heart, but you can also percuss and estimate generally the size of the heart, moving from the axilla medially and then from the sternum laterally, if you needed to do that. So then I think anything else with the chest I need to do. Again, I'm always looking at skin, so it's a little bit harder because she has clothes on as opposed to a gown. But if I were to see an abnormal mole, anything, a rash or a lesion, anything like that, then I would take note of that in my exam. Okay, moving down. I'm looking at her arms, looking at her hands and her skin. She's got nail polish on, so it makes it hard to do a cap refill, but I would look for that to refill in under 3 seconds. I'll go ahead and have you lay down for me. When she did that, I'm looking at her abdomen. I know Grace very well, so this is okay. Looking at her abdomen, as she lay down, I didn't see anything would indicate a hernia or diastasis. I don't see any visible, masses or anything that concerns me.
I've had a hernia before.
Do you now?
No.
Yeah. See?
Didn't
see it. So I'm gonna listen first. You always auscultate first.
Don't bite.
Now listen to all 4 valves or quadrants.
I'm
For
like
bowel sounds.
starving, so if you hear something, that'll be fun.
Yep. Good.
I think listening to the stomach's the coolest thing ever.
So bowel sounds are present, normoactive, good tinkling sounds. While I'm here, I'm going to listen for her aortic, iliac, renal, and I won't do femoral, but just listening for any bruits there. And all I hear is her stomach growling.
I always listen to my stomach. It's fun.
And I don't hear any bruits. I don't hear any whooshing of blood. Move your knees a little bit, lady. All right, no, down.
Oh,
Okay.
Over.
Now I'm gonna do some light palpation, just feeling for anything superficial of concern. And I don't feel anything, and then I'm just gonna push a little bit deeper. Again, feeling for any masses or anything that just would pop out as being abnormal. Of course, on the right upper quadrant, if I were to push up under here, it's possible that I could palpate the edge of the liver. Some patients you can, some you can't. Here on the left upper quadrant, it's not usual to be able to palpate the spleen, nor are you usually able to palpate the kidneys. It takes very deep palpation, and you would lift up under her back and then like push really deeply, but that's not normally something that you are able to do. Again, I'm looking at skin, and I don't see anything. A couple small moles, but they're normal borders and all that color. Okay, go ahead and swing back around, my dear. All right, now getting a little thirsty. I'm going to assess for, I'm going to feel her pulses. So, and again, with all these things that you're doing side to side, like lung sounds or pulses or strength, you do one side and compare it to the other, because that's the best way to assess normal finding versus an abnormal finding. Her radial pulses are 2+. I'm going to do your brachial. Can find it. Those are fine. And then I'm going to come down and assess the ones on her posterior tibial, and then her ones on her feet. Which sometimes those, if you're not able to find them, that can be normal even in a young, healthy person, and you can Doppler those if needed. Okay, strength, go ahead and squeeze my fingers, not gonna hurt me. And she's got good strength. I'm gonna have you push against my hand. All right, and then put like here.
Yeah, go up.
Yeah, but do this other foot first. Push down on my hand. She's just pushing against my hand, and she's pushing up, like not letting me push her foot. Well, yeah. Anyways, normal strength. Of course, like I said, I saw her walk in, and you know, I know she's a young, healthy, active person. Where did my hammer thing go?
Oh, where did that go?
My reflex hammer, we were just using it. Okay, let me go back to a couple.
Oh. There it is.
All right, I got it. But let me go back to a couple things that I just actually thought about. Sensation. I mean, this can be assessed anytime. I won't. But so this on the face, and this is going to test for the trigeminal nerve. So we close your eyes. Close them. Okay.
I feel it.
Okay.
Feel it.
She feels it. And then I'm going to go ahead. I'll just use this. Close your eyes. Keep it closed. Tell me where I'm pushing.
Right here.
Where is that on your body?
My lower arm.
Okay. All right. Close your eyes.
Oh, right here above my knee.
Okay.
Down.
Close your eyes. All right.
But
Okay. So her ability to discriminate where I'm touching her with a dull object is intact. And then back to hearing. I missed this earlier. But there's a variety of hearing tests you can do. There's the whisper test, the Renee test, and the Weber test. And we'll just do this real quick. So I'm going to strike this, put it on your head, and you just tell me if you hear it both sides or one more than the other.
I don't hear it.
Okay, hang on. I didn't hit it hard enough.
There we go.
Maybe. Hang on.
I feel the vibration.
Okay. She feels that on. Is it equal?
Yeah.
Both sides? Okay. Okay. Then reflex hammer. There's deep tendon reflexes. There's the radial. There's the brachioradialis, the triceps, the patellar, the Achilles, and this is her favorite, so we'll do the patellar, and you can see it. So scoot back a little bit so you're not, so that your feet dangle. Is that working?
They're kind of dangling.
There we go. We did this a second ago and it worked, so we'll see.
Ah, that was a big one.
Really?
Yeah.
Okay. So, you
fun.
want to do
Yeah.
You want to do both sides, and you would do that with all of the deep tendon reflexes, both sides, to make sure they're equal and that they are intact. So again, she has pants on, but I would ideally have her in a gown, and I would be looking at her skin. Lots of times you ask patients to self-report on those things as well. Trying to think if I've missed anything. I don't know. I think that pretty well covers it. The beautiful thing about an exam is that if you miss something, you can come back to it later, and most times patients don't notice. So, and that I have a nice healthy patient here that gives me a normal to which I can compare abnormals to in a true clinical setting. So thank you for watching.